there is insulin or even excess insulin, but it's not working properly. Acanthosis nigricans, that black, velvety, shiny skin. PCOD, insulin resistance. Because of the insulin resistance, PCOD, both can lead to obesity. Obesity again. Hello, welcome back. The video topic today is insulin resistance in women. So we all in the previous videos seen a lot of videos about the insulin resistance, their causes, what are the effects, and how to treat and all. But this is exclusively for women. How insulin resistance can happen, or how it can affect the women. So, like any, we all know, insulin resistance means there is insulin or even excess insulin, but it's not working properly. So that is called insulin resistance, that can lead to metabolic syndrome, a chain of reactions in the body. So how to diagnose this insulin resistance? Though we can diagnose it by blood tests, insulin resistance blood tests, but even before that, even the patient or the person themselves can know they have an insulin resistance by self-examination. First and foremost, they'll have a central obesity. They'll be obese and central obesity will be there. Acanthosis nigricans, that black, velvety, shiny skin in and around the neck, axilla, groin, in between the thighs. These are very positive signs. And they may also have skin tags, especially around the neck and axilla, even the inner thighs, small, small skin tags. They are all again a sign of insulin resistance in women. Again, too much of dandruff, resistant dandruff, too much of dandruff, again a sign of insulin resistance. Depression, all those things could be a possibility, but of all the things, mainly central obesity and weight gain leading to metabolic syndrome. Once the insulin resistance comes, either they will be diabetic, or they may even get PCOS, the polycystic ovarian syndrome, or PCOD. So their cycles become irregular. So because of the PCOD, insulin resistance, because of the insulin resistance, PCOD, both can lead to obesity. Obesity again can cause these two. So like a vicious cycle. The same way, when a woman reaches menopause, there is a sharp fall in estrogen. When the estrogen falls, the insulin resistance is multiplied. So that can lead to central obesity, or they put on weight or fat in the stomach part. That is very, very resistant to lose. In spite of any exercise, diet, that particular fat is very resistant to lose. The same way, uh, their sleep pattern can change. All this can sign of insulin resistance. So how to treat that? Very simply, we all know that first is weight reduction. So first start with walking, at least 30 to 45 minutes of daily walking, and no food after 7 p.m. That is very, very important. Of course, protein rich diet, no carbs diet, much the better, and minimum 7 hours of good sleep. This is very important. And the menopause time, the usually women are protected against any cardiac problem like heart diseases or block in their blood vessels and all. But because of this insulin resistance and the pre-diabetic state or metabolic syndrome, their protection against the heart diseases is lost. So even women like men can get heart disease early. So that is the reason why we have to treat the insulin resistance in women also aggressively, by exercise, losing weight, diet, good sleep, more vegetables, and all these things very important. And insulin resistance when it comes, and just by doing all these things, don't expect, within few days or months the insulin resistance go back. No, all these lifestyle changes should be part of life. So if you feel, or if you have insulin resistance, consult your doctor. And being a woman, take extra precaution. Thank you.